Hi, I'm Monica Centers, and I'm with Adaptive Hospice. I serve as the marketing director in Southern Indiana. Hospice is a lot of things. Hospice is compassionate care for people who are going through a life-limiting illness, and maybe they aren't seeking additional curative care, but it's also care for their family and their caregivers. It focuses on hope, quality of life through pain and symptom management, emotional support, spiritual support for not just the patient, but also for the family. And that care is done wherever that patient lives. The time for hospice is when a patient gets to the point where curative care can no longer control the illness or the disease that is happening, and when there is really a life-limiting diagnosis at that point. Hospice provides so much to the patient and their family. It's help and it's hope. And it's care and support from a team of professionals who focus on providing comfort and managing physical symptoms and emotional and spiritual needs. So once a patient is enrolled in hospice care, they begin receiving visits from their care team. So this includes a nurse, and it can also include a certified nurse's aide, a social worker, a chaplain, bereavement coordinator, and volunteers. The nursing visits address the physical symptoms in the care management plan. CNAs help provide personal care like bathing and grooming. Social work assists with coordinating additional community resources and within the family. Visits from the chaplain provide spiritual comfort. Volunteers help provide additional companionship. Bereavement support for the patient and the family may be needed or requested prior to end of life and is also available following the loved one's passing. Hospice also provides at no cost to the patient any medication, supplies, and medical equipment related to their hospice diagnosis. Hospice care can be provided to a patient wherever it is that they live, whether it's at private residence, a nursing facility, or an assisted care facility. Hospice is covered by insurance, by Medicaid and Medicare at 100%, and it is really one of the most underutilized benefits of both of those programs. But it is also covered under private insurance with whatever deductibles or coverage parameters that somebody may have. A referral for hospice care would be needed if we are going to do an evaluation and then admit a patient. But to sit down and have a conversation with someone who is looking at hospice, wants to know more, that's just a conversation that anyone can request and does not need a doctor's order. There are so many misconceptions about hospice care. The first thing is that hospice means giving up, and it doesn't. It is the complete opposite of that. Hospice is hope. It's focused on quality of life, and it's focused on help. A couple other misconceptions on hospice care is that it means that somebody may not be able to keep their own doctor, when in fact they can. If that doctor is agreeable to doing that, they may keep their doctor. They already have that relationship. Other things that people fear about hospice means that somebody is imminently dying, and it doesn't. We've had patients on service for over 6 months and over a year. And that may not be the same case for everybody, but it certainly doesn't mean that somebody is imminently dying. And there's a couple of things that we hear about hospice once we're caring for a patient, whether it's from them or whether it's from their family and caregivers. One is, I wish we would have done this sooner. they didn't realize how much hope and how much help that it really gave them. And that's what it's all about for that patient and their family. And it also, another thing we hear is, I wish we would have been told about this, or somebody would have talked to us about this sooner, at least so they knew what was available to them, what it was, and maybe to talk about that misconception that they have. That way they know what's available to them if they decide to use it. Something else that we often hear from our families is, we don't know how we would have done this without you, because of all the additional help, whether that be the emotional, the pain and symptom management, or even just the financial help to families that this gives them, because it is covered under their Medicare, Medicaid, or their insurance. It is a tremendous help to those patients and families.